Hi, I'm Robert Beauchamp for Training on the Imaging Software. Today we're going to be talking about how to add images in the library. So the library, in my opinion, is one of the most powerful tools you can utilize in practice in regards to enrolling patients for treatment. And when you're showing patients the problem, which is what we're doing with the intraoral camera and the X-rays, this is where it allows you to give them the perspective on a problem. And then the next step is really to be able to utilize your library to click and show them the treatment options. So this is where within the library, you go to the global library, which is the library that is specific for education. It is the library that no matter what patient you're in, when you click on the library and you access the global library, this is the same library that you're going to see every time. And you can easily right-click on the word global, add specific folders, whatever you want to call it, and you can then have a folder and you can drag and drop images from any patient. And what the software will do is it will make a copy of the image. It will remove the personal information on that image from the patient, and it will create a copy that you can utilize for educational purposes. So when you are showing possibly some of the treatments that you'd like to be showing, like if you did want to show maybe some whitening that you've done, well, you can double click and you can double click and you can show the patient some of the whitening treatments that you've done to enroll them for some type of whitening treatment or bleaching in office or take-home systems. And that's where we can see the before and afters, of how the whitening has an impact on the smile. Now, I do advocate that you use handheld SLR cameras. This will really show the impact of how whiter teeth can really brighten up the face and how it can change the perspective of what a person looks like. So this can be done for whitening. It can be done for cosmetics. So if you wanted to start to even utilize some softwares to put these pictures together, and then you import them in and you save them in your global library to show some of these wonderful crown cases that you've done, some of the composite restorations that you were able to provide, some of, again, the veneers, the crowns, the implants, whatever you're trying to enroll patients for. You can use this educational library to show the quality of the work, to show other people that have accepted these treatments, and to explain those wonderful stories that shows how a wonderful smile can transform somebody, physically, emotionally, confidence-wise. You can really show how people do change and how it can impact people, and show them how it can change them. So the educational library is, I find, to be one of the most powerful elements that you can start to build in your practice for a wide variety of reasons. Be it to explain things that you want to explain, the steps of a crown, if you want to show before and after cleanings, just to show the value of those treatments and those cleanings, to show the before and after crown, or before and after amalgam to composite. It really does impact the patient's perspective on the treatment and the value of the treatment, and how good they look, and how that investment in their oral cavity has improved the way they feel, look, and function. And this is how we can do it through this global library. The other library is the hashtag library here, is actually the patient's library. So this is a sort of a database. It's the background. It's where every single image you've ever taken on this patient is going to be saved chronologically by date. So important that on your new patient questionnaire that you add that images acquired, in your file, may be utilized for educational purposes, and to get consent from patients to utilize their images. That would be an important element to incorporate into your new patient questionnaire or new patient information. And then you can then have the freedom to start to use these images to educate and enroll patients and show them different scenarios.